Oftentimes, patients are concerned about whether or not the procedure will hurt or how long it will take, and most importantly, the effectiveness, depending on what it is we're treating them for. We give some medicine to help both relax the patient and prevent pain. And then when we put the frame on, we also give some numbing medicine in the areas where the pin sites are.
So nursing provides, in addition to just emotional comfort, we're with the patient, of course, from the beginning when we greet them. And then we're also there during head frame placement, whether that's just encouraging them or helping them to relax, even holding a hand during the process.
The amount of discomfort people experience is short-lived because once the frame is actually on, it just feels tight around the head.
Out of the 4 to 5 hours of procedure time for the Gamma Knife treatment, the most discomfort or pain will be during head frame placement, which would last 3 to 5 minutes.
Before the procedure starts, we give patients good medications to ease up all the discomfort and to calm them down.
This is the head frame here. You can see it's a rectangle. It has a post at each corner and with a pin in each post. It's very light, weighs less than 2 pounds.
The Gamma Knife head frame is attached to the skull with 4 pins. These do leave a small mark in the skin, but there's no drilling of holes in the skull, and there's no permanent damage of any kind to the skull. Once the head frame is removed, it's really as if you had 4 tiny pinprick areas in your skull that are probably no bigger than the end of a pencil.
I don't have any cases, any recall of any patients that after that I had any problems with the head frame. And then after so many cases, I know that for sure.
The next step is to measure the patient's head. It's because everyone's head size is a little bit different. And we do that with this device. We put it on the frame. Then we use a ruler to take measurements in each of these positions.
Once the head frame is on the patient, our patient is taken to MRI, where the MRI, which will be used for treatment planning, is performed.
The MRI clearly delineates the internal structures of the brain that we need to see.
Many times by then, the patients are pretty relaxed and actually ready to kind of rest during the planning process that's occurring between the physicians.
And that process takes anywhere from 30 to 60 minutes. We're then ready to begin the treatment. We'll bring the patient into the Gamma Knife treatment room and make sure everyone is in agreement with the treatment about to be delivered.
They actually don't feel anything when the Gamma Knife treatment is delivered. In fact, there's no noise, there's nothing that touches them. They lay down on the table, they go in the machine for a while and they get their treatment. A lot of times we play music as requested. Most of the time at that point, the patient frequently will fall asleep during the treatment. They're relaxed, and again, that's the easiest part. They lay on the table for a half hour, hour and a half, and they come out and they're done. And when the head frame's removed, they just get a Band-Aid. There's no stitches required. It's just a small mark that heals quickly on this patient's skin.
After treatment, what we hear most is that the patient is very grateful for the treatment that they've received, the care that they've received, and especially if we held their hand during the head frame placement. But they are glad that it's over with and done and that everything went smooth for them.
They immediately, all of them, realize the tremendous advantage that they have with that procedure against the other procedure. So they are totally grateful of it.